Hello friends, polycystic ovarian syndrome or PCOS is one of the most common endocrine disorder found in big group of women in the world. And this PCOS or the polycystic ovarian syndrome is one of the main reason behind the infertility problem in females. One of the widely using oral anti-hypoglycemic agent Metformin is using for the treatment of PCOS. So what is the link between this Metformin and the PCOS? Today we are going to discussing about this topic. Welcome to another chapter of 1 Degree Change, a continuous learning program for the pharmacist. This PCOS is a endocrine disorder. Before going to the PCOS, first we can see what is a normal physiology. As part of the ovulation, these eggs are forming inside a sac-like structure called the follicle. And when as the egg grows, the follicle also start to enlarge and fluid is filled up inside the follicle. And when this egg is mature, the follicle will break down and egg will release. And this is a normal mechanism happening in the body of females. But in the case of PCOS, it is believing that women they are suffering because of PCOS have the more male hormones or the androgen in their body. Because of this, the egg will not completely mature. The follicle will start to grow up and fill with the fluid, but egg will not mature. Because of this, the follicle will not break and egg will not release. It will remain as a cyst, and this condition is called as polycystic ovarian syndrome. And because of the formation of like this cyst, it will leads to the infertility problem. The studies are showing that increased amount of insulin inside the body will leads to the increased production of male hormone like androgen, and this increased level of male hormone like androgen is the cause for the PCOS. This condition like insulin resistance and the problem in the insulin receptor sensitivity is the one of the reason behind the increased production of insulin. Once this production of insulin will increase and the male hormone level get increased, it will leads to the PCOS. And the major signs of the increased male hormone level in the body is the acne and the oily skin, dandruff, weight gain, sleep apnea, and male pattern baldness. That means the increased hair growth. And this process is continuous, and it will lead not only the infertility problem, it will lead to diabetes mellitus, cardiac problem, stroke, etc. So the one of the most commonly using medicine for the treatment of polycystic ovarian syndrome is the Metformin. When we are giving the Metformin, as all of you know that the main mechanism of action of Metformin to increase the insulin sensitivity. So because of the increased insulin sensitivity, it will reduces the insulin resistance, and if the insulin resistance will reduce, automatically the amount of insulin secretion will come down. If the amount of insulin secretion will come down, automatically it will reduces the abnormal production of androgens, and this will help to prevent treat the polycystic ovarian syndrome. Because of this mechanism, the Metformin is the one of the most commonly medicine that is using for the treatment of PCOS also. The main reason behind the development of PCOS is genetic and the environmental factor. Lot of lifestyle changes happening also will leads to the PCOS. So along with the Metformin, lot of other lifestyle modification and lot of nutritional supplements also will help to reduce or prevent the PCOS. This chapter we will discuss about the main patient counseling points and the nutritional recommendation for the PCOS. I hope all of you understand why Metformin is using for the treatment of PCOS. Thank you for watching my video, and if this information has helped you to make a 1 degree change in your professional life, please share with your friends. Thank you.